The time's now 9:15. Irritable bowel syndrome is an intestinal disorder that causes the digestive tract to not function properly. It affects millions of people, and April is designated as IBS Awareness Month. Dr. Sarah Schwertner joins us now to talk more about this disorder and how you can treat it. But first of all, good morning to you, Dr. Schwertner.
Good morning.
So we all have probably heard the acronym IBS over the years and think we know what it is exactly, but can you tell us from, again, your medical perspective, what IBS is exactly?
So IBS is where the digestive system doesn't function properly. We believe that there is a missignaling between the brain and the gut, and this can be a chronic condition.
And so I know there are lots of signs and symptoms of GI issues, but how does IBS present compared to just maybe stomach bug or, food poisoning, let's say?
So IBS has certain symptoms such as abdominal pain, cramping, constipation, diarrhea, and these are chronic, whereas if you had food poisoning, it's kind of like a few days of it and then it goes away. And these symptoms can come on and come and go off and on throughout your life.
For people who suffer from IBS, are there certain things that trigger flare-ups or trigger any of those symptoms to be more persistent?
Yes, there are certain triggers. So foods, of course, some foods will be a trigger for one person, maybe different than another person. Drinks such as caffeine and alcohol. Stress, a lot of people experience the symptoms when they're under an enormous amount of stress. Traveling can even trigger the symptoms, and it is a chronic condition, so they can come and go with the different triggers.
Are there any specific groups of the population who are more at risk for developing IBS?
So people in their late 20s are more at risk. Women usually have more IBS, but also we think that men are far less to seek treatment of it. If you've had someone in your family that's had IBS, there's always that genetic factor that plays a role. If you have any mental health condition, such as a psychological trauma, anxiety, depression, those can also cause IBS. So we believe that, the gut is the second brain, especially if there's some sort of mental health or disorder.
Right, telling your body, the rest of your body, that, hey, something is not quite right here. I know there are lots of treatment options, and I guess it also depends on the severity of your IBS, but what options, medication, et cetera, are pretty standard for people who suffer from IBS?
So there is no cure for IBS. One of the things that you can help to prevent it is avoid some of those triggers. You might want to make a food journal, and that way you can keep track of what is causing those symptoms. Another thing is exercise, meditation, or seeking mental health professional to help with those types of causes of IBS. And then also there are some medications that may help with the symptoms. Like I said, there's no cure, and over-the-counter probiotics can actually help restore your normal gut flora and prevent IBS symptoms.
But because it's such a different disease depending on who has it, it's kind of a conversation with your doctor to see the best course of action for your specific case of IBS. I know we also have listed here in our notes something called Primary Care Plus. Tell us about that. We have about 30 seconds left.
Okay, so you can find out more at primarycareplus.com, or you can like us on Facebook.
And that's where you can find more information on IBS and treatment options out there as well.
Yes, ma'am.
All right, Dr. Sarah Schwertner, we appreciate your time this morning.
Thank you.